20 million new cancer cases, causing over 9 million deaths globally. Engineered cell therapies have revolutionized blood cancers. In this type of treatment, we isolate white blood cells from the patient. We engineer and expand them in the lab, and then we reinfuse them back to the patient. In the case of blood cancers, these therapies, there are no physical barriers between the engineered cell and the cancer cell. They can easily detect and eliminate them, and thus achieving remission rates above 80%, a rate that we can't see in any other treatment for cancer. In the case of solid tumors, such as lung and colon cancers, these therapies cannot readily cross the bloodstream to effectively reach, infiltrate, or persist within the hostile tumor microenvironment. And we at Triacyte are going to bring these therapies, these same therapies, to solid tumors. Who are we, you may ask? So this is myself, Akram. I have 10 years experience in immunology and immunotherapy development. This is Professor Cyril Cohen. He is the chief scientist of the company, and he leads the tumor immunology and immunotherapy lab at Bar Ilan University. This is my brother Ahmed. He's the CEO of the company. He has 15 years experience working with pharma companies, management and operation, and a lead of AI that will join the company and will be disclosed soon. Triacyte is a pre-seed biotech company. We are utilizing AI and genetic engineer to develop next-generation cell therapies. By making these therapies accessible across all types of solid tumors, we are offering a new hope to millions of patients worldwide. We call our receptors HEP receptors for homing, infiltration, and persistence. These are designed using AI and genetic engineering to enhance the homing, infiltration, and persistence of the engineered immune cells. And it's designed as a plug-in module that can be easily integrated into genetic constructs for in vivo T-cell engineering. Our cells are designed to detect specific molecules secreted by the tumor into the bloodstream. These signals will trigger migration and infiltration of the engineered immune cells within the solid tumors. Upon arrival, our cells will be able to recognize and eliminate cancers. Our beachhead is colorectal cancer. In the US, there are 155,000 new cases every year, creating a potential market of 30 or more than $30 billion. Our aim is to using a single treatment of our engineered cell therapies to achieve remission rates above 80% in this indication, similarly to the blood cancers. These are the expression levels of our leading target in cancer tissues in red compared to healthy tissues in green. You can see that it's barely expressed by healthy tissues, but it's expressed in different cancer tissues, especially in the colon. And here to the right, we can see, zoom in on the expression level in cancer in red compared to healthy colon in gray. And clearly the levels are significantly enhanced. We took this compound secreted by the colon and tested its effect to enhance migration of our engineered cells in test tubes in vitro. And we were able to demonstrate that the presence of this compound enhanced the migration of the engineered cells by 2.5 folds compared to the non-engineered cells in blue, which means that equipping the cells with HEP receptor will enhance the migration of the engineered T cells. Our overall goal is to bring this therapy to all types of solid tumors, which is a market that is currently evaluated by $170 billion. Our business model is to partnership with strategic partners to develop our therapies internally, and we are also open to license our technology to companies that are developing non-compete cell therapies for solid tumors. We will be soon, in 2 months, starting raising our seed round. We are aiming to raise up to $7 million in order to show in vivo proof of concept of 10 times enhanced cell migration and infiltration in vivo, which means in animal models. Thank you very much, and I look forward to connect with every one of you.
Thank you, Dr. Akram.